Part 5, the last part of this lecture series, Relationships in Anatomy. We will discuss 9 topics. First is about scalp and meninges. These are the layers of the scalp: skin, connective tissue, aponeurotic layer, loose connective tissue, and pericranium. The mnemonic, of course, is scalp. Next to scalp, of course, you have the skull, and then down to the inner part you have the meninges. These are the layers of meninges. You have dura mater, arachnoid mater, and pia mater. Mnemonic DAP. So if you combine all, you have scalp, skull, and DAP. The superior orbital fissure. There are 8 structures that pass through this fissure. To remember all, we can use this mnemonic: live free to see of absolutely no insult. Superior transverse scapular ligament. It's located right here. That one is the superior transverse scapular ligament. The artery passes above the ligament. That's the ligament. You have the artery passing over it. And imagine an army moves above the bridge while the nerve passes below the ligament. You can imagine the Navy passing below the ligament or the bridge. Pharynx is partly where food passes through. So the mnemonic is eat food with your pharynx. Larynx is where the voice produced. The mnemonic is sing la 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 with your larynx. Thorax. This is the arrangement of the vein, the artery, and nerve at the costal groove of the rib. So to remember, from close to the bone outward, you have van. This is significant because when you are doing some procedure such as thoracentesis, you will know the location of the nerve. Right lung has 3 lobes, just as R has 3 strokes, while left lung has 2 lobes, just as the letter L has 2 strokes. Inside the thorax, we have here the mediastinum. And then from the sternal angle of Louis to the space between L4 and L5 is the imaginary line called transverse thoracic plane. Again, this is the transverse thoracic plane, showing some contents or organs inside. Along this plane, we have From the anterior part, the rib. Then next to that is aorta, followed by trachea, pulmonary trunk, left recurrent laryngeal nerve, azygos veins, and several other nerves before the thoracic vertebra. To remember, you have rod plant, rib, aorta, trachea, pulmonary trunk, left recurrent, ligamentum arteriosum also, and then azygos drains and nerves, and then the thoracic vertebra. Apertures in the diaphragm and their corresponding level along the thoracic vertebra. Vena cava exits at T8 level. Esophagus exits at T10 level, while aortic hiatus at about T12 level. So to remember, you have the number of liters is equivalent to the thoracic level. Thoracic duct right here is in between the esophagus and the azygos vein. So mnemonic is a duct between two gooses. Bifurcations. C4 level is bifurcation of common carotid artery. At T4 level, you have bifurcation of trachea to its right and left branches. And then you have at L4, bifurcation of aorta to right and left common iliac arteries. To remember, just remember that in every fourth level, you can find these bifurcations. Bifurcation of aorta again. Remember that abdominal aorta is in between L1 and L4. So it bifurcates at L4 here. So about the same level as the umbilicus in front and L4 at the back. So again, this is L4. To remember, B4U, bifurcation of aorta, L4, and umbilicus. Lumbar puncture. Lumbar puncture is performed between L3 and L5. This is to avoid the spinal cord, which often ends at L1. The lumbar puncture should be done between L3 and L5. So to remember, you can have this rhyme. To keep the cord alive, keep the needle between L3 and L5. Thigh. You have femoral triangle. Lateral border is the sartorius muscle. The medial border, the adductor longus muscle. And then the superior part, you have the inguinal ligament. Again, sartorius, adductor longus, inguinal ligament, or sail. So you can remember that this triangle forms like or shaped like a sail. These are again the structures in the inguinal region. Here you have femoral nerve, artery, femoral vein, and then the lymphatics in the inner part. So from outside towards the navel, you have our mnemonic, navel. Nerve, artery, vein, empty space, and then lymphatics. Navel again. The pathway of sperm through male reproductive tract. You have the seminiferous tubules, epididymis, vas deferens, ejaculatory duct, nothing, urethra, and then out to penis, to the penis. So here, the path of the sperm going out. To remember, you can use this mnemonic 7-up. That ends the lecture series. Have a great day, everyone. Stay safe.